Welcome. This is a presentation for the Bariatric program at Inland Valley Hospital. This is the pre-op class, What to Expect. My name is Elizabeth Wittes. I am the Bariatric coordinator here at Inland Valley Hospital. I am a registered nurse, and I have been here for Inland Valley for 20 years. Inland Valley Hospital is located in Wildomar, California. This is the admission office where you will get your paperwork done. Inland Valley Hospital is a center of excellence designated by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. We just were recertified 2 weeks ago as a Bariatric Center of Excellence, and we're very proud of that. In the past, we have been awarded health grade certificates for Center of Excellence, and again, there's the Bariatric Center of Excellence logo from MBSA QIP. The Bariatric program is an overview. We are all here to help you reach your goals for good health and a healthy living. Our goal is to help you learn what to expect from your hospitalization here at Southwest Healthcare System. The agenda for the day is going over respiratory therapy, what to expect while you're in the hospital. The dietitian will give you guidelines after your surgery. We will do a bariatric pre-op testing, and then we'll have a conclusion and question and answers. What I'm going to talk about next is the surgery times for the different procedures. The Roux-en-Y procedure, or the gold standard of bariatric surgery, is approximately 60 to 90 minutes long. The sleeve gastrectomy is anywhere between 30 minutes to 45 minutes. The recovery room will be about a 1 to 2 hour stay, and then you will move up to the surgical floor for your post-op care. If any condition warrants, you will go to the ICU. Visiting hours are from 11 a.m. to 8 p.m. on the medical floor, and we encourage family members, just one, to stay in the room with you. Post-op requirements are very, very important to prevent complications. First off, we're going to talk about the respiratory complications that can happen. If you do not breathe correctly, if you do not use your incentive spirometry, you can develop pneumonia. To prevent this, we have the head of the bed up. We encourage coughing and deep breathing, splinting your tummy with the use of a pillow. We also check your oxygenation with a pulse oximetry on your finger. And we also encourage 10 times every hour the use of your incentive spirometry. Or every time a commercial comes on, I want you to use your incentive spirometry. If you have a diagnosis of sleep apnea, your CPAP mask can be brought to the hospital and we will provide the machine so you can use that. You've had surgery. You're going to have pain. Our goal is to have an acceptable pain level. We rate our pain on a scale of 1 to 10, 10 being the worst possible pain and 0 being no pain. You need to ask your nurse for pain medicine. With laparoscopic surgery, you are filled with gas to help visualize your abdominal area. You will have gas pains radiating up to your shoulder. To alleviate these gas pains, we encourage ambulation, the use of your incentive spirometry, splinting and coughing, and of course asking for pain medicines from your nurse. Changing positions, and again, ambulation is very important for the pain control. For your cardiac assessment, we will be continually monitoring your heart rate with a telemetry monitor. We also make sure that you have your sequential compression devices on. Those go around your calf muscles and it helps prevent blood clots. Also, early ambulation helps prevent blood clots. These SCDs will stay on your legs all the time unless, of course, you're bathing. And the first 24 hours, you will have nothing to eat or drink. You will be NPO. And then we will encourage a clear liquid, sugar-free diet once this is ordered by the physician. The pictures on the screen, the top one is the SCDs, or sequential compression devices. The picture to the right is a telemetry monitor with a pulse oximetry. The bottom picture is a picture of an intravenous line. And the picture to the left is a picture of a Foley catheter This is only needed if you are unable to void. We encourage you to get up, walk to the bathroom, and void in the restroom. Again, pictures of the bariatric unit, the bed, the facilities, the long, beautiful hallway where you're going to be walking up and down, and the nurse's station. So the day of surgery, after you have visited the preoperative area and after you have had surgery, you will move to the recovery room. If you have had surgery in the morning, we will encourage you to get up and move that night. If you've had a later surgery, 12 o'clock, 1 o'clock, you will be encouraged to get up and out of bed the next day. Again, the diet for the first 24 hours is nothing to eat or drink. You will be given mouth swabs to keep your mouth nice and moist. And then the doctor will see you the next day and he will advance your diet. There are no restrictions. We encourage early ambulation, the use of your incentive spirometry 10 times every hour, keeping your SCDs on at all times, asking for pain medicine when necessary, and we encourage you to ask questions about your care. Pain control on post-op day 1. Once you have a diet, you will be switched from IV pain medicine to a liquid pain medicine. Again, you need to ask for the pain medicine. Activity, walking, walking, walking. We want you to walk as much as you can. When a diet is ordered, it is bariatric step 1. This is, again, the clear liquid diet, sugar-free fluids. You will be given a medicine cup, which is 30 cc's, and you will take a sip from this medicine cup every 15 to 20 minutes. The medicine cup is not a shot glass. You will sip it every 15 minutes. The nurse will give you several at the bedside so you can monitor and count how many you've had. You will be seen by the dietitian on post-op day 1. On post-op day 2, you'll be able to go home. Dr. Saw or the other physicians will come and see you, make sure that everything is okay, and he will give you explicit discharge instructions. Your nurse will print up doctor-specific discharge instructions. You will return to the doctor within a week. You will call the doctor if there is any unrelieved pain, any fever, if you're not able to tolerate liquids, or if you have any questions, you are encouraged to call. And again, your bedside nurse will be giving you written discharge instructions, including medication, diet, and what exercise you can do.